Hey, what's going on, people? Mudman here. I hope everybody's having a wonderful day uh, and living life to the fullest, man. You got to go out there and do what it does and do what it do. Get things done. And as for me, I told you I would update you about the surgery that's happening on the 22nd. So, as of right now, I have no arrival time. I won't get that until the day before the surgery, which will be Tuesday. In process for this surgery, I was overweight. Not by like the way that they talk about weight is crazy because they like so I'm 5'7" and I weighed 259 pounds at this point in time in May. Currently sitting here now, I have lost 59 pounds. I am sitting at 200 even, wearing clothes that haven't fit me in years, and I don't know what to contribute that to. So I had blood work done, and the blood work showed that my red blood cell count was good. And the other thing, the hematocrit or whatever, I mean, they were high. Both of those were high, but slightly high, like 51.8 or something like that. And it's supposed to be 50 point something. So it wasn't that high. So the doctors aren't that worried about it, I'm guessing. So I done the x-rays on chest. All the tests came back good. Surgery's a go. The only thing is that the surgeon tells me, well, Mud, here's what we're going to do. We're going to do a laminectomy, but I don't know how bad your back is inside. I said, okay, so are you going to fuse it? Most likely going to have to fuse it. 18 months. My legs been like this. My back's been like this. In this state. I broke my back in 2011. I also fractured vertebrae in 2020. I also fractured more vertebrae in 2024 and 2023, leading to them to think, hey, maybe you have something underlying with you. So they do a DECA scan, which tests for osteoporosis, and come to find out, at the time I was a 36-year-old man with osteoporosis, something that's not common, Like, it's crazy. So I lost 59 pounds. I've been on testosterone symphonate for for years now, but just never seen no gain in cause I couldn't lift, couldn't do nothing, never done nothing. So I started this thing that I started doing where I got sick in July at my stomach hurting real bad. Go to the hospital, they do CT, they tell me everything's good, but I have pancreatitis. Well, that's weird because I don't drink. I'm not a drug addict anymore. Haven't been in 9 years. Never had problems with my pancreas. Why am I having problems with my pancreas now? So, they put me in the hospital. I stay overnight. I get discharged the next day when all my levels go down. So then, so they want to send me to nuclear medicine for my stomach, and I'm like, yeah, that's fine. So during the process, I started eating less than 1,000 calories a day, and that included drinking everything. But if I wasn't drinking water, I counted the calories to the Sprite I drank. Um, the first 2 to 3 weeks felt like I was starving to death, like I was hungry, but it was where I was overeating because I am a bored eater, a depression type eater to some extent. Okay, I am an anxiety eater, but depression kills my appetite. Does that make sense? When I'm nervous, I eat. When I'm depressed, I don't. So, knowing that I'm 256 pounds and knowing that I have to have this back surgery done and knowing I have to have osteoporosis, it was my choice. I was like, maybe I'll just try this 1,000 calorie thing. Don't eat after 8 p.m. and before 8 p.m. try to have it like on a 5 hours where a period a day where I eat, and then it's been working, dude. I lost 10 pounds last month alone, and I've lost 14 pounds a month before that from just watching what I eat. So I go to the surgeon on the 14th, and he says everything's good. Where to go? Talk to anesthesiology. Talk to everybody there. Give me thumbs up. As for the pain I'm experiencing, it's currently 10:42, and I'm sitting on the edge of the bed instead of in my chair. The reason for this being I can't get up. I've taken my medicine, still no luck getting up. I feel like I have no feeling, like I never can feel my right leg in regardless anyways for the past, well, since December of last year I haven't been able to feel my leg. So nothing but pain. Just the only thing I feel is pain. It don't move with, like, I'll go to walk and the motherfucker won't move with me. So it's like trying to figure all this out and trying to figure why my left side is lower than my right side, and I know why, because it becomes sync. So the surgery is going to fix that. But the pain I've been in and things I've noticed is that the closer it gets to surgery, the more the pain, the worse the pain gets. And I don't know if that's a mental thing. I don't know if that's if it's actually physical or or what, or what the problem could be, because sometimes I have these new pains and feelings in my back. Like, I get these knots on my back and they're not really hard, they're mushy. They feel like water building up around the area where I'm going to have surgery at. And I don't know if that's normal or not. Like, the pains went to my left side, and so what's weird is that when my back does the bad thing it does, where I can't walk at all, or I can barely walk and need a walker or like two canes and shit to get up and to move, when it does that, then I lose feeling of everything from my belly button down my legs. The only thing I can feel is my left knee down to my left foot. That's the only feeling I have at certain points during the day, is knee down on my left leg. So they say it's all coming from the L4, L5, S1 area. I believe that, because that's where it's hurting. I'm not afraid of this, to have this surgery done. The surgery doesn't scare me. What scares me is the anesthesiologist and the anesthesia. That's what scares me, because I don't like going to sleep on other people's terms. And I know it's surgery and it's my terms, but I still feel like, hey, just let me fall asleep, then you do it. Put me under, because it feels like more under my terms. But I'm not scared. I'm like excited, like I'm like giddy. I want to get it done. I want to have it done. Because I've just been hurting so long that it's like, Doc, you want to do this? I don't care. Do it. Doc, you want to do that? I don't care. Do it. You want to do this while you're in there? Do it. I don't care what you do while you're in there. Just make me stop hurting. That's what I told him. Sad news is then he comes back and tells me, well, Mud, here's the issue. I can make your leg stop hurting, but it'll never completely stop hurting. Like, he's like, there'll be times during the days or during the weeks where your leg will feel the same as it does now, just because that nerve's been compressed for so long. Well, will any amount of physical therapy help? He's like, right now, to be honest with you, I don't. The MRI, he said, can show me what is going on, but I can't make a decision on how to fix you until I have the lamina off of your spine and see the debris. And the lamina are the bony points on your back, like you feel like dinosaur spikes. That's the lamina. So they're going to be removing those from the L4, L5, S1. So I'm looking for a fusion to be done as well because, like I said, I have osteoporosis. The stability of my spine is weak. I have, so I think there's like a total of 13 fractures in my spine. So if we can make it through this, we can make it through anything, gang. And look, I know a lot of people don't care to watch these, but like to watch these type of videos that I make just talking, but these help me with my mental health. Guys, y'all don't understand. Men need to speak up when it's like when it comes to life threatening situations and mental health awareness. Like men need to speak up. A lot of men sit here and they suffer. Or you see athletes go back, but then you have my doctor tell me, hey, you'll never do the work you once done again. Not with osteoporosis, not with having this surgery. So what am I supposed to do? As a man, how do you not get depressed? As a man, how do you not feel like you let your family down? As a man, how do you feel like, how do you move on knowing that your contribution to the family that you put so much time and effort into is going to be minimalized to almost zero for a short period of time? But for a long period of time comes a new job that I'm going to have to try to find, or a new job that I'm going to have to work, or a new something. And I'm hoping YouTube can be that something because I need something, guys.